RWD-RLT-24 veterinary laser therapy uses Class 4 high-power lasers to deliver non-invasive, deeply penetrating, fast-healing treatment. The therapy is applicable to a wide range of symptoms. With better pain relief and minimal side effects, it helps to reduce pain, relieve inflammation and edema, and accelerate tissue repair and healing. With more than 1,300 built-in treatment procedures, this easy-to-operate therapy can be used to treat a range of diseases in cats, dogs, horses, and exotic animals. The maximum average power of the therapy reaches 24 watt, with fast laser energy transmission and reduced attenuation. This product can be used to treat both large areas and deep tissues. In addition, course of disease can be reduced by more than 40%, while pet compliance is also easier to achieve. CW, pulse, and ISP emission modes help achieve the effective transmission of laser energy tailored to disease severity. ISP mode reduces the filtration of light by the surface tissue, making it suitable for the treatment of deep tissue ailments. 650 nanometers, 810 nanometers, 950 nanometers, and 980 nanometers laser wavelengths are available for different cases, allowing for a wider scope of clinical application. With 5 different treatment heads, veterinary can easily choose a treatment method according to the size of the treatment area, further improving laser transmission efficiency. Quadruple protection. The laser's operation is further optimized through TEC active temperature control and internal fan, while the fiber protection disc and anti-warping connector protect the fiber from damage. Interact with the machine through the 7-inch HD touchscreen. Hit the emergency button to stop operations at any time. Watch the demonstration video to help you get started. Shine the laser, the pain disappear. RWD Veterinary Laser Therapy optimizes your healing process. RWD-RLT-24 veterinary laser therapy uses Class 4 high-power lasers to deliver non-invasive, deeply penetrating.
Against all these threats and challenges to life, constant progress of research in life science and tight collaboration in relevant industry chains are essential for achieving better vital quality. Originated in 2002, RWD has been constantly furnishing customers with reliable solutions and services in life science, animal health and clinical medicine, and dedicated for better vital quality within our wits and powers. Our products have been sold to over 100 countries and regions around the globe and won worldwide customer confidence and support. At RWD, we launched 6 solutions in the fields of life sciences, animal health, and clinical medicine at the forefront of the world, including animal surgery and modeling solutions, in vivo imaging solutions, neurosignal research solutions, histopathology solutions, animal diagnosis and treatment solutions, which evaluate diagnostic efficiency and treatment efficacy of surgery with anesthesia, dental services, rehabilitation, and physiotherapy, urinary system diseases, etc. And our assistants, science researchers, have published thousands of papers in a number of world-leading academic journals, including Nature and Science. On top of that, many scientific research institutions, medical institutions, and pet diagnosis and treatment centers have attained their success by leveraging our 6 solutions up to now. We will maintain cooperation and innovation with an open mind, boosting growth within many industries through joint efforts with our partners.
So we've been collaborating and cooperating with RWD for quite some time now. and their self-developed products have helped us in the laboratory maintain accuracy and improve accuracy. We're really happy with RWD's products, and we're really excited to see what they've got in store, their future products that they have in store for the future, and helping researchers worldwide.
Mein Name ist Dr. Heinrich Krollebusch. Ich bin seit 30 Jahren praktizierender Tierarzt und seit 20 Jahren beschäftigen wir uns schwerpunktmäßig mit der Narkosetechnik in der Kleintierpraxis. Uns Tierärzte treibt das Wohlergehen unserer Patienten an, sowie die ständige Verbesserung ihrer Lebenserwartung und ihrer Lebensqualität. RWD hilft uns dabei mit hochmoderner Beatmungstechnik und ebenso modernen Lösungen für Diagnostik und Therapie. RWDs Hilfe können wir Tierärzte sicherer und effizienter operieren, aber gleichzeitig sorgt RWD auch für eine verbesserte Lebenserwartung. Das Wohlergehen unserer Patienten und die ständige Verbesserung ihrer Lebenserwartung und Lebensdauer treibt uns Tierärzte an.
As a national high-tech enterprise, RWD ascribes great importance to technology research and development. Based on 4 technical platforms, including optical imaging, precision transmission, accurate temperature control, and detection of weak signal, we have a grip on leading core technologies across many fields. Since RWD's founding, the company has invested hundreds of millions on research and development, gaining almost 100 patents, both domestic and international, as a result. In addition to a sound manufacturing base, advanced processing assembly line, and precision detection system, RWD has built an integrated control system that monitors all aspects of operations from research and development to manufacturing. The name RWD comes from the transliteration of the English word reward, meaning payback to society. Reward is not only the original aspiration of the creation of RWD, but also the continuous belief of the company. In 2016, RWD launched the RWD Preclinical Medicine Enlightenment Scholarship to help with the development of research talent in China's preclinical medicine. So far, the scholarship has been awarded to 38 institutions of higher education nationwide. As the Vice President Unit of the Huxley Wildlife Conservation Society, RWD has donated medical equipment and supplies for wildlife relief and the conservation of the natural ecosystem. In 2020, RWD donated clinical medical supplies worth over RMB 1 million to the Giant Panda National Park to help with safeguarding our national treasure. In the future, RWD will continue to contribute its wits and powers to enhance vital quality and help global customers unlock vital mystery and safeguard vital health.
Deeply penetrating.
So welcome everyone. We are now set to start. I would like to start by thanking you and welcoming you for joining in today in this webinar where we will discuss all things laser therapy, including a broad use that you can make for your laser equipment if you have one already, or to maybe launch the seed of new thoughts, new approaches, new ideas of applications that you can make with your laser, making not only improving the outcomes that you get from your treatments, but also to improve your patient quality of life and to improve profitability and return that you get from your equipment. I would like to thank RWD for inviting me and for making this possible. It's always a great pleasure for me to talk about laser, and this is one of the topics I like the most. So hopefully I will be able to help you to step up the game of your laser therapy. We will be having a Q&A session at the end, so if you have any questions regarding the topics that we are going to discuss, or any other thing about lasers that you would like to see answered, you can write them down either in the chat room or in the Q&A section, and I will go through all of the questions at the end. My name is João Alves. I'm a sports medicine and rehabilitation specialist working out of Portugal. And today I'm going to share with you what has been my experience with laser and some of the uses that I make with my equipment and some of the things that we are looking for in the future as future possibilities. So I divided this in two major changes or two major groups. We will discuss laser therapy or photobiomodulation. This is now the most commonly used term and the preferred term, but we are going to use the two interchangeably. We are going to discuss its use in rehabilitation, which is still the most common use for lasers, but also in a much broader clinical context, in different conditions for different patients, and things that we see on a day-to-day basis. So a lot of uses that we can give to our equipment. So I'll start with a brief introduction. I will start by introducing you a study that I like a lot. This is a real study that was published a few years ago in the British Medical Journal. In this study, the authors looked at the effects that using a parachute or not would have upon jumping from an aircraft. This may seem a little bit silly or obvious, but this is a real study. And what the authors tried to look was if someone used a parachute or not when jumping out of an aircraft, if there was a significant difference between the two groups in terms of death and also major trauma. So they were able to recruit 23 subjects, and they randomly divided them between two groups. One of them received a parachute, and the other group received just an empty backpack. And they jumped out either an airplane or a helicopter. They look at possible outcomes as the occurrence of death or the event of a major traumatic injury after jumping. So you should be thinking by now, which were the differences between the two groups? It's quite obvious, we would say. But interestingly, what they saw was that there was no significantly difference between the two groups, meaning there was no difference in terms of occurrence of death or major injury between the two groups. And why was that? It doesn't seem that obvious. Well, we should do always something that we don't normally do, which is look at the methods and what the researchers were actually studying. And when we look at the methods, we saw that in fact the participants were jumping out of an aircraft, but the aircraft was stationed at the floor, so they were jumping out of a height of 1 meter. What this means, and the authors conclude that, is that even though there was no significant difference between the two groups, we should be very careful when extrapolating the findings of this study to a broader clinical population. What this also tells us is that we should always read the methods and understand what is actually being tested and what type of parameters are being used. This is true to pretty much every approach that we do in veterinary medicine, but it is particularly true when we talk about lasers. Because I'm sure if you did research or a search for findings and studies about lasers for the same conditions, you'll find a lot of variability in terms of results. One of the things that we can consider is that the laser doesn't work that well. But most of the time, I would say that those differences are most likely attributed to the different parameters that are being used. When we look at different lasers or different devices, and I'll use lasers interchangeably with photobiomodulation, we have a lot of parameters, as I suppose you know. You have irradiance, you have power, you have fluency, then you'll have different areas being treated because not all protocols are the same. And those differences will amount also for the differences that we see in the results. So today, I'm going to show you a few studies to back up most of the uses that we already do. And I will say that laser is able to do this or is able to promote that. But every time that I say this, please keep in mind that what I mean is this specific laser protocol is able to do this or that. So other than saying laser is able to do this, we should probably be saying this laser protocol is able to do this or the other thing. So keep that in mind when we go through this presentation. So let's start by the most common uses that we give to our lasers. Rehabilitation is probably the most common use. If any of you or all of you work with rehab, you'll be familiar with lasers. It's something that we use on a daily basis in pretty much all of our patients. So here the modality is quite set in, and it's a household name by now. But given that we've been using lasers for rehab for quite so long, does it make sense to still be discussing this? And I say yes, I think it still does. And I would even argue that this can be presented as a condition of life and death. Why is it? If we look for studies looking at reasons for euthanasia in dogs, we'll see some very important findings. One of them is that reasons or conditions related to poor mobility or musculoskeletal pain ultimately lead to the owners selecting for euthanasia. And we see here a few of them, like poor mobility and pain in joints, but also poor mobility or weakness. Those can be seen as interchangeable, but also a decreased activity. Because most of the times, and this is understandable, because most of the times the animals will, if they're in pain, if they have stiff joints, they have osteoarthritis, for example, they will not move as much. They will be less willing to interact with the family, to greet the family when they get home, or even to move to eat. So this is quite common. And if you think about your clinical practice, sometimes we'll see animals that are in a very frail shape. They can have like chronic kidney disease. They are really thin and emancipated. But as long as they are still able to walk around, to move, to interact with the family, to go for the toilet, we will still define that as having some level of quality of life. It's when the animals stop moving, when they stop being active, that we usually associate that with a loss of quality of life. And these parameters are probably the most obvious ones. But if we look at others, like, for example, I referred a decreased ability to eat or drink, but also changes in the way the animal interacts with the family. And this can go from looking for seclusion or to be isolated, or even to turn more aggressive and snapping, trying to bite, growling. Those things are quite noticeable, and there are a lot of behavioral problems that can be attributed to chronic pain. But also a decrease in cleanliness. Cats, for example, will stop cleaning themselves. Or house soiling is a big problem because, for example, a cat cannot reach the litter box, or the dog is not able to go to the appropriate site for urination or defecation, or even to come outside. And another thing is sleep disturbances. The animal will become restless, will not sleep properly, and will not let the clients sleep as well. So there are a lot of things that will influence the animal's quality of life, and that can ultimately lead to an increased risk of clients choosing and families choosing for euthanasia. So this is quite a big problem, and I think we are still lagging a little bit behind in addressing these problems. This study came out of the US We might question, is this just a local problem? But not so much, because if we look at a similar study now in the UK, we will see again musculoskeletal disorders at the top of percentage for euthanasia, and also a measurement of a poor quality of life. We are not really sure what that means. It can mean a lot of things, but as we can see, there are a lot of things that can be attributed to poor mobility. You see up on the list also behavior disorders, and behavior problems can be collected or connected to chronic pain. So there are a lot of things regarding mobility and rehab that can ultimately lead to rehabilitation problems and to pain. So there are a lot of things that we can do from the rehabilitation standpoint to improve our patients' quality of life, and also ultimately to prevent them from dying from those situations. And one of the most common problems is osteoarthritis. We know that osteoarthritis is very common. We have variable numbers of prevalence that can go from 20% to 98%. This is a very big gap, but it's probably more related to the age of the sample in those specific studies. But we know that we have not only high prevalence, but those numbers are going to grow because our animals are living longer, and that's a good thing. It's also a reflection of a good job that we are doing caring for these animals. But it also leaves you more time for the disease to set in place. So the animals are going to live longer, so more osteoarthritis, but also more time for us to manage the disease. Particularly, and also because many of our pets worldwide are becoming overweight, and we know that fat predisposes to the disease. And because we now have a lot of data showing that we should be diagnosing these animals earlier. Usually, osteoarthritis was a disease of older animals, and the mean age for diagnosis would be around 8 years old. But we have very recent data that shows us that animals, in this case dogs, from the ages of 8 months up to 4 years of age, nearly 40% of them already have osteoarthritis signs, radiographic signs, and around a quarter of them actually have clinical signs. So this is something to be managing really early on, not just from the old dog, but mostly probably from the young adults or even at the puppy level, looking at predisposing conditions and keeping these animals with the proper body weight. And it's the same picture in cats, not just dogs. We know that we have high numbers of osteoarthritis. I would say that the numbers are probably on the higher end of the spectrum rather than on the lower ends, just because cats are better at hiding their complaints, and maybe we are worse at detecting them. Not all cats allow a proper physical examination. Not all clients and all families are able to properly identify the problem. So there's also a education problem here. But we also know that a lot of cats are overweight, and they are also living longer, just same as the dogs. So we need better tools to manage this condition, particularly if we are going to treat these animals for 10 years. Maybe think about it. If you have a dog or a cat that is diagnosed by the time they are 4 years or 6, and they end up living until they are 16, that for a cat is not that uncommon. It's not really spectacular these days. We will be managing those animals for 12, 10 years. That's a lot. That's a lot of time to be providing medication, for example. It increases the risk of side effects. Even with the newer modalities that we now have, we know there are several concerns about long-term use or even short-term use. So we need good approaches that are effective, that don't have side effects, and that can be used safely for a very long time. And we already have in the literature different studies showing that laser can be quite helpful in osteoarthritis in different joints. We know that, for example, in dogs, elbow osteoarthritis can be a little bit more challenging to manage compared to hip osteoarthritis, but we've seen from different studies, and these have been replicated through time, that laser can be quite helpful. For example, let's start with the laser study with dogs with hip osteoarthritis, where we used laser and we compared its effects with a standard NSAID. In this case, we used meloxicam. And what we saw was that we had an improvement in the laser group only by the first follow-up at 8 days with most pain scores that we use. CMI means clinical nephrology instruments. We would know, and we have several of them available. One of them would be the Canine Brief Pain Inventory that looks at pain levels. Another one is the Liverpool Osteoarthritis in Dogs, which is a scale specifically designed for dogs with osteoarthritis. And we also have the Canine Orthopedic Index. And what we saw was that with laser, we had significant improvements from the first follow-up, something that didn't happen with the NSAID group. And also what's interesting was that the improvements lasted for quite a long time, even after we had stopped the treatment. So the treatment itself has some longevity, which is also interesting. For the laser group, what we saw was that the animals improved and they took longer to return as they were when we started treatment. We also saw an improvement in range of motion, and we were using digital thermography in this study because it can be used to look at inflammation levels as it reflects in local temperature levels at the joint. And we saw reduced inflammation as measured by the temperature levels, and also improvements in range of motion and pain scores. So laser, it's quite effective. It can be by itself, in this case for the hip, or if it's not completely successful by itself, it will allow you to incorporate it in a multimodal approach and reduce the amount of pain medication that you need to give to the animal on a daily basis. And that's also quite important. We know that most animals that have chronic pain will need to have some sorts of long-term management modalities. And one of the approaches that we would like to introduce long-term is to have a minimal effective dose. So laser can help either to remove other medications depending on the animal and the joint itself, or if not completely possible, at least to reduce the number of medications or the number of administrations that you need to do. And we did replicated this study also. We know that, for example, we've been using lasers in rehab because one of the things that it does is improve comfort, but it also has an interesting side effect, which is it increases tissue temperature, which allows for a more comfortable tissue mobilization. So for example, this is something we already do in most rehab sessions, is to induce range of motion. But now we have clinical proof that shows that laser actually increases range of motion in joints. So this is something that we can continue to do and to introduce in our patients before we do mobilization or massages and every other exercise that we might do on a rehab session. As I told you before, we actually did a follow-up to this laser study where we looked at dogs with osteoarthritis and we divided them in 3 groups. One group received photobiomodulation, a second group received PRP, platelet-rich plasma, and a third group actually received the 2 modalities combined. And this was a nice study because what we did was a crossover study. So after 6 months, so we followed the animals for quite a long time, we actually crossed the groups, then we followed them for another 6 months, and we crossed them again. So all animals went through all 3 groups, and we followed them for 6 months at a time. And what was nice to see was that laser can do two things. One of them is the laser is able to improve mobility, and also, as you can see on the bottom side, the bottom image, we also use objective measures. It also improved objective results in dogs with osteoarthritis, but in combination with PRP, it actually had a synergistic effect, which means that laser is not only helpful by itself, but we can also safely use it in combination with other modalities, which is very important because when we do a multimodal approach, one of the concerns that we have is possible interactions between the treatments or the medications that we are giving. And here we see that laser is helpful, not just by itself, but also in combination with other modalities. It doesn't have any deleterious effect. Actually, it builds on the effect of other approaches that you are using. And we've done this with PRP and also with other treatments like mesotherapy. I don't know if you're familiar with this one, but this is a treatment modality where we inject medications into the skin and it creates a small deposit on the skin. And from there, it goes to the underlying tissues. What it's nice for is it allows for the medication to reach the target tissues faster without systemic exposure. So it's quite safe. For example, if you have a dog with renal disease or kidney or liver disease. And we look at two groups, one of them receiving just mesotherapy and another one receiving the two treatments at the same time, receiving mesotherapy and a laser session at the same time. And as you can see, at Radius, so it's the group that received the two combined therapies. At the first follow-up after 2 weeks of treatment, we have over 70% improvement in terms of pain scores, and that's quite remarkable. There aren't a lot of modalities that we have available that will have such a dramatic improvement in terms of condition. So what this shows once more is that we can actually add laser to the protocols that we are using, even if we are happy with our current protocol, and by adding laser, we can actually have better results with the same modalities, and they are still quite safe. So there's no problem in terms of contraindications or interactions between the two, which is quite reassuring, particularly, again, if we are going to treat these animals for a very long time, which we should. And it's not just osteoarthritis. If we look at the literature that we have available, we'll see a lot, and even more studies are coming out about the use of laser for other conditions. For example, hernias, those are very common ones, not only for post-op, but also for the conservative management of animals that are not surgical candidates for whatever reason. And also in other conditions, for example, degenerative myelopathy, we have a lot of promising studies already published and more of them coming out each day, something that we can be using on a daily basis. So this is a great equipment for rehab, but probably you already knew that but all of the things that I'm showing is actually just building on the information that we have. And this is, for example, a problem that is commonly presented to veterinary medicine and to rehab is that we don't have a lot of scientific and background to the modalities that we do. But that is not something we can definitely say about laser, because we have a lot of information already available and more information coming out each day. So something we can use quite comfortably and with confidence in our patients really early on and for a very long time. But let's look at different applications. There's a lot of things that we can use our laser for. And this is an exercise that you can do. If you want to think about possibilities for your laser if you have one, or if you want to think about possible uses for a laser if you were to get one, just think about it. The effects of laser are a reduction in inflammation, there are better pain control, analgesia, and also an increase in tissue regeneration. So every condition that has an itis to it, that it has inflammation, your laser is going to help. Every condition that needs to heal, your laser is probably going to help with it. Every time you have pain, whatever the reason for it, it's post-surgical, it's musculoskeletal, it's an otitis, whatever situations you have, you can use a laser for it. So there are a lot of applications that we can give. And if you have a laser already, think about the number of patients that you're missing out if you're not using your laser for all of the things that you do. I can tell you, I spent years trying to convince my boss to get a laser. They didn't see the point. It was quite an investment for our practice. But after we got it, it quickly became the most used equipment in our practice by far. And it now comes to a point where we have free laser equipments working full-time every day. So it's quite remarkable. We use it a lot. What do I use it for? Well, one of the most common conditions that we use it for is gingivitis. Either if you're treating dogs or cats, we know that gingivitis is a problem. In cats particularly, a lot of cats end up losing all of their teeth due to gingivitis, and they don't feed as well. They have a lot of problems related to it, but also dogs, where we have a lot of animals that have periodontal disease. So we looked at, in a study, what we did was dogs with periodontal disease that came in for dental prophylaxis, routine teeth cleaning. And at the time of the teeth cleaning, we did a laser session. And what we saw was that animals that were treated actually had, we treated all animals, but we treated halves of the mouth. So we reduced animal variability from the equation. And what we saw was that we had lower gingivitis scores, and the animal overall seemed to be more comfortable. We only use this for lower grades of periodontal disease, but this is something that we actually do. It didn't go into the study, but we use it quite routinely to every approach that we do on the oral cavity. If you have to clean an animal that has a higher level of periodontal disease, if you have to do teeth extractions, for example, if you have an abscess, if you have cats with gingivitis and you don't want to give immunosuppressants all the time, and laser is very good for these conditions. We can do it either with an open or a closed mouth. And the nice part is that most animals end up liking this a lot because it's quite comfortable. If you have ever had laser done to you, or if you've seen an animal receiving laser, most of them understand that that part is really good. That part of the treatment is quite comfortable. And they will lie down on the table or on the floor if you have a mat for you to do the session. So it's really nice, even if you have a cat that is not so nice. For example, once they learn that it helps, they will come up for you and they will enjoy it. Another thing that I use it a lot is for diarrhea. Diarrhea is probably the most common reason for visits for a general practitioner, and even not only for the general practitioner, we will see diarrhea very commonly. It's a common side effect, either by a variety of conditions, from parasites, from food intolerance, for a dog that hasn't eaten something it's not supposed to, or has gone to the garbage, whatever. It's really, really common. And not only is it common, but it is also a reason for disturbance within the family, let's say like that. Nobody likes to come to home at the end of the day and see an unwanted gift on the floor. And sometimes there's not a lot that we can do. we can add medication, which is not needed most of the time or in all occasions. We can use probiotics. We use a lot of things that actually are trying to help, but they are not actually treatment by itself. So we actually looked at a bunch of dogs, working dogs, that had stress-related diarrhea, either by excitement, which is very common in working dogs, or related to exercise, because there's a thing in human medicine called runner's diarrhea. And if you ever exercise, or if you still do, maybe you'll have this experience itself by yourself. When we're running, or if we walk a lot, it also increases intestinal motility. So if you run a lot, there are a lot of people that will have episodes of soft stool or even diarrhea. And particularly in working dogs, but for all dogs, this is not really easy to manage. We can add fiber, which was something that we used as a control group in this study, or you can use probiotics, but you'll still have some episodes from time to time. And what we did was we treated these dogs with abdominal laser, and it worked extremely well. If you look at the pictures, on the left side, you'll have the last bowel movement episode that the dogs have. So we have different grades of diarrhea from a level 6 in the Bristol scale to a 7 at the bottom, and the first episode after the laser session. And what we see, it's quite a dramatic change, as you can see. We went from almost completely liquid stool, or at least not foam at all, to molded feces. And in addition to this, what we also see, which is quite harder to measure, is that the animal were more comfortable. Because for the client, maybe the diarrhea itself, it's the main problem, but the dog is going to have abdominal discomfort and pain. They have gas, they have colics. So laser helps a lot at that. There are a lot of different types of diarrhea, that's obvious, but every single time you'll have pain, you'll have inflammation, and laser will help with that. So think about all the dogs that you have, and this, if not a cure, in some cases it is not, but it can help with managing those cases really early on and to improve comfort and decrease pain. What we also use it for is for surgery, either by improving wound healing, which is something that we commonly do. We usually only do a session. For example, post-surgical, we will do a session immediately after surgery. And every time that the animal comes in to check their stitches or to remove the bandage. But also you can use it to improve if you have an infected wound, that unfortunately from time to time it's going to happen. If you have an infection, it's going to help because it also has an antibacterial effect. So it will help with healing in that area by decreasing infection and also by improving healing. It also have an analgesic effect. And one of the things that we tried it out was in dogs that receive elective gastropexy. So if you see a lot of large breed dogs, particularly those that are deep-chested, like Belgian Malinois, German Shepherds, Great Danes, you'll know that they are greatly predisposed to having GDV. So one of the things that can be discussed with the clients, it's the possibility of doing an elective gastropexy. And we did a study where we looked to groups of dogs. To one of the groups, we did our standard protocol, which behaved quite nicely when we look at pain scores, because we do a lot of blocks. We do a local block at the level of the skin, and also in the incision, we do in the abdominal wall. And the animals were actually quite comfortable and with low pain levels. But by adding laser, what we saw was an increase in comfort postures, but also the animals started eating sooner, which can be related to the fact that they were actually more comfortable or less nauseous, or that we increased or improved gastrointestinal mobility. So there are a lot of uses that we can give to our laser following surgery, not just to improve healing, but also to improve patient comfort. Even if we're using a lot of different modalities, because ideally we would use a lot of analgesic modalities, this is another one that we can use and add in our toolbox. Other things that we can use, other types of wounds that we can try to manage with laser are periannual fistulas. You'll know that there are certain breeds that are predisposed, for example, the German Shepherds. We don't know exactly why, but it seems to have an immune-mediated background behind it. There are a lot of treatments proposed to it, from surgery to immunosuppressive therapy, and then also looking at managing possible local infections and even a concurrent food allergy. But usually this is a long-term commitment. It's not easy to manage, it takes quite a long time, and it's quite cumbersome from the clients to be managing this. And it's also very stressful for the animals because it's a source of chronic discomfort. It's a source of chronic pain when they're trying to defecate. So it's quite hard for them and for us to manage as well. But as you can see, by using, and in this case, we used laser exclusively, we see a very dramatic decrease in inflammation from a very early stage. So the animals are quite more comfortable. Even if you're doing other things like cleaning or applying a local medication, it's much easier to do once the animal is more comfortable. They will allow for you to touch on the area, to clean whatever you have to do. And if we continue doing this, you see here the 1 week barrier. Most of the inflammation is gone, and this is healing quite nicely. These cases I usually treat with 3 sessions on the first week, and then I'll start trying to decrease the number of sessions. One of the things I still do for chronic conditions is the 3-2-1 protocol. The 3 sessions on the first week, 2 on the second one, and 1 session on the third week. From that point on, we will try to find the minimal effective dose to manage that animal. And in some situations, we might not be able to decrease below 1. We may remain at 2 every week, every other week. It will depend a little bit on how the animal is progressing and how things are changing through time. But it's quite helpful in these situations. Another thing that we can use is in fracture management. So I'll show you a specific example. When in working sporting dogs, their musculoskeletal structures are usually under a lot of stress. They have to jump, to run, to turn around. And from time to time, they will have small fractures. Sometimes it's not that common for us to have like a very big fracture or a huge trauma episode. So most of the fractures that we have are quite small. And for those, the treatment can be oftentimes rests, which for a working dog is quite challenging, and for most dogs, I would say, and also limiting activity. So it's from our interest and from the dog's point of view as well, for us to increase bone healing as much as we can. And we actually had an example of a dog that while playing with a handler, he went to retrieve his toy and he did a sharp turn while grabbing the toy from the ground. The animal yelped at that moment, and when he returned to the handler, he actually had a little bit of a head tilt. And when we did the x-ray, we were able to see this fracture over here on the atlas wing. We consulted with the surgeon, and the surgeon said, because this was not a displaced fracture, as you can see here from the side as well, this was not a displaced fracture. It didn't have a surgical indication. So we started by doing rest, and we did 3 sessions of laser on the first week. And from that point on, we were actually doing it twice a week until we had a bone healing. And by the time we were doing it for 6 weeks. We did a CT, and as you can see, on the wing itself, we had a complete bone healing at this point just by 7 weeks, even though here at the basis of the wing we still had an incomplete healing. So we kept at it using the laser every 2 weeks until we had twice a week until we had complete bone healing. By the time we had, I think, 9 weeks, so it was quite faster compared to just rest, where it usually takes us up to 12 weeks to have a complete fracture healing. So it was quite helpful, not only for the healing itself, but also to manage inflammation and pain around that area, because the animal was a little bit stiff on the muscles around the neck because they were trying to immobilize that area. So it was not only helpful just for the bone healing itself, but also to manage everything else that was happening at the same time. We can have other uses. If you're familiar with acupuncture, you can use your laser to do laser acupuncture. And I don't do it that often because I don't have a lot of training in acupuncture. I have another person that usually does this in the dogs that I follow. But in this case, we had a dog that showed up with facial paralysis. We don't know the reason for it. We know that German Shepherds have some predisposition for the condition, either by trauma, either being blood trauma, or for cold, related to cold exposure, or it's just idiopathic. And for this animal, what we did was we treated on those points that you see here in the middle picture. It's a very fast procedure to do. For each point, I think it takes about 20 seconds. And we did 3 sessions on the first week, and then we started doing 2 sessions a week from week 2 until we had complete healing. As you can see, by the time we had 4 weeks of treatment, by day 30, the animal was completely healed. You see it's a very completely different facial expression and full functioning modality. The animal is able to apprehend food to drink without any problem from that side. So it was a quite nice turnaround considering how we started. Another thing that we use it a lot is for very large wounds. You'll see descriptions in the literature for different sources of this wound. In this case, it was an insect bite wound. It was a relative of the wasp. We'll see probably 1 to 2 cases, like big cases like this one or 2 cases a year. We see quite more smaller situations where for the first couple of days or first day or 2, you'll see increased swelling, really dramatic, and the swelling is to such an extent that the skin ends up dying. So you have a lot of skin necrosis, and we need to clean that up. And you can see on this second picture here the extent of this wound. We have a smaller wound here and this big one over the shoulder extending up to the elbow. That was quite big. So we cleaned this up and we did a laser session at that same moment. Here we're doing sessions every other day, because here we actually combine this with PRP. So to keep the PRP in place, we placed a bandage on, and we were doing laser on the days that we exchanged the bandages. But what you can see at 48 hours is that you already had a little bit of shrinking on the wound side, but most importantly, we have a lot of granulation tissue coming out from the middle. And this will help close the wound quite nicely. And after a week, we can already see quite a dramatic change in size. You see the smaller wound here actually has decreased quite a little bit. You see the skin here tucking a little bit in. It decreased around 50%, I would say. And also this bigger one Around the elbow, it's almost closed. You can see here it was quite wide, and here it's almost closed. And the other one is decreasing in size quite rapidly. The bigger one, so the smaller one closed faster as it was it was to be expected. It was a smaller area to complete. And the larger one actually took around 8 weeks to close up. We were doing at the end point almost, I think, 2 sessions a week most of the time. 2 to 3 sessions. By the time we removed the bandages, at that point we were doing 3 sessions a week. And what's nice to see is that at this end point, not only we have a complete healing of the wounds, but we also have a nice cosmetic effect. Obviously, you'll see some scar tissue, but considering the size of the wound itself, it's quite nice, but also a very good functional outcome out of this. Because one of the problems when you have a lot of scar tissue is that it's going to decrease mobility because it's going to be very stiff. But this is not happening here. This is a working dog, a very active dog, and he has no motion restriction around this area, which is very good in terms of outcome, not only for the wound itself, but also post-wound, the outcome that you get. And we are now looking into the future for future possibilities for laser. We know that on the human side, we have a lot of studies coming out showing that laser actually is quite helpful in a lot of conditions. For example, depression, Alzheimer's, Parkinson as well, post vascular incidents, we have strokes, we have a lot of new information coming out showing that laser is helpful by increasing blood flow, but also by decreasing inflammation, which is related to some sort of mood disorders. This is a very big topic in human medicine, and we are now starting to see it in veterinary medicine as well. We saw a first study coming out about the use of lasers in dogs with cognitive dysfunction, which is quite a promising field for us to use, particularly as many of our animals, thankfully, are living longer. But I also think there's a lot of potential for using this for our hospitalized patients. Our animals that sit a long time in the hospital will most surely go through things that are related to depression or just to improve welfare and well-being. I think laser can be quite helpful. So, for example, in a hospital setting, you'll see a major application for your laser. Another quite interesting and promising uses for laser is for the management of cancer. We know that cancer and lasering over cancer areas or tumors has been a relative contraindication for photobiomodulation, but that consideration was mostly due to our lack of knowledge, whether if laser would be helpful or not, but also due to a concern since laser actually increases healing and replication, that it could be detrimental in cases of cancer. We now know that it's not true, and you'll see very dramatic changes in some types of tumors being treated with laser by itself, or at least to manage some of the side effects that you get, like those from radiation, from nausea. There are a lot of uses, and for example, I know a specific oncologist that does a lot of chemotherapy and a lot of radiotherapy. And when the dogs have diarrhea, for example, they will always laser the dog. It increases comfort. It will help the dog or the cat, the animal, to eat better. And if they have skin injuries, for example, it'll also help in skin healing in that case. So there's a brave new world out there, a lot of new possibilities for our equipment. So In conclusion, we already have been using laser for quite some time. We know that it's helpful. We have a lot of information behind it, but there's a growing body of evidence coming out every day for new applications and even for older ones. So we should be quite comfortable with using our laser in a broad range of applications, which are not only restricted to rehab. There's a lot of things that we can do in rehabilitation for sure, but on the general practice in other areas of veterinary medicine, there is also a lot of things that we can use our laser in. And the good part, because it's just such a safe approach and effective one, we can either use it as a single treatment in some situations or as a part of a multimodal approach for a lot of conditions. For sure, it's not going to cause any harm. It's going to most likely than not actually improve the outcomes that you're getting, which is always a good thing. We are providing a better treatment for our dogs, for our animals. They are living longer and better. And also, why not say we also have a better income because we are doing a better service. So thank you, or as we say in Portuguese, obrigados. I will now go through any questions that you might have. So let's see what we have. So one of the questions that we have is about the use of laser in infections. So the question is, laser therapy I'm not sure if you are able to see the Q&A, so I'm going to actually read the question and then go through the answer. Laser therapy can accelerate microcirculation. For septic wounds, is it possible that laser will induce bacterial multiplication and accelerate bacteria moving to other areas with blood flow? So this is a good question. I would say probably not. We don't actually know why, but for example, when we are doing abdominal laser to manage bacteria, for managing diarrhea, one of the things that has been shown in microbiome studies, both in dogs and humans and rats, is that by decreasing inflammation, actually we have an increase in, I'll say, good bacteria and a decrease in pro-inflammatory bacteria. So it has a positive effect. And the effect that laser has on circulation, usually what it's considered is that it helps blood flow in that area, and by doing so, it will help bring up white blood cells that will better combat those bacteria on those areas. I understand the question, but for some reason, it seems that laser don't have a bad effect on this point. It targets bad bacteria, similar to what sun exposure actually does in most wounds. And it will help with decrease inflammation, which is probably one of the good things that it does in combating infection at the local level. And it seems, I would say, probably by reducing inflammation to promote positive bacteria or good acting bacteria that we have on the skin or in the gut or in any other location. And those would also help balance the other bacteria. I hope that it fully answers your question. So another question that we have is, how do we evaluate the effect of laser, in particular when we are applying laser therapy combined with other treatments? This is a good question. This is a very common one that we get, particularly in rehabilitation. And the quick answer is, if we're doing a lot of things, it's hard for us to know which one is doing which. I'm sure you'll be familiar with the 20/80 rule. This is a management rule that can be applied to veterinary medicine or medicine as a whole. And one of the things that we know is that 20% of the modalities that we are doing are going to be responsible for 80% of the outcomes that we are getting. Why this is important is that we need to find the ones that are giving you the most results. And with laser, we know that, for example, they are able to increase healing, because we've done studies before where we look at laser or no laser. In rehab or osteoarthritis, for example, we did studies where we looked at laser or no laser, or laser versus an NSAID, or laser with PRP, or laser in combination with PRP. So actually laser is one of the things where you'll know that it's working, because we've done the studies where we just use laser. If you would like to try this in a patient, I would probably say do the protocol that you normally use for whatever thing that you are using, for example, for a wound, and laser half of the wound and don't laser the other half. Or have a group of animals where you'll have laser and others that where you don't. If you're doing rehab, for example, try adding laser, or if you have osteoarthritis patients, treat some with oral medication and others with oral medication and laser. You'll see the difference. It's quite noticeable. But I understand the question. It's a very common one. If we're doing a bunch of things, it's hard for us to know which one is actually doing which. But with laser, we actually have the research showing that it works. So another question that we have is, which are the contraindications of laser? So most of the contraindications that we have are actually what we call relative contraindications. And they are relative because they came out of prudence, because we didn't know if it was a good approach to use it or not. I'll give you a few examples. So one of the contraindications I already talked about was tumors in oncology. One of the things that we wouldn't use laser for would be tumors. And this relates to the first question, was that because we know that laser can improve tissue regeneration and multiplication. So this would be something that we wouldn't want in tumors. But we now know that what laser does is not actually increase tissue regeneration or multiplication. What it actually does is to return it to normal levels. So if you have inflammation at the local level, that will decrease tissue healing speed. So by decreasing local inflammation, you'll actually bring tissue healing to the normal level. And it will also have an effect on the mitochondria, and that will help with metabolism. So we now know that you can use laser in tumors. Also, but here I will do a caveat and be careful, look at specific types of laser, but I've seen multiple cases where this has been used as a modality, for example, to manage edema or after treatment side effects. Another contraindication would be, do not treat over the gonads or the gravidic wounds if you have an animal that is pregnant. This came out of precaution, but for example, every time if you're doing a abdominal treatment with laser, and if you don't have a spayed female, you'll go through the ovaries for sure. And I have never seen problems with that. And in human medicine, you now have laser treatments being used for the management, in this case, male infertility or erectile dysfunction. So a lot of these things are being reviewed. One of them, the major contraindication that is still in play, is we don't laser over the eyes, because it will burn the retina and the animal will go blind. That's why you saw the cats in the pictures and the dogs with the goggles. And the other one is you need to use a proper technique, because as you're delivering energy, that will heat the tissues. And if you don't use a proper technique, you'll overheat the tissues and you will burn the animal. So that's the contraindication. But those are related actually to poor technique in most cases. We now have a question in Portuguese, which I will translate. Regarding to the device itself, which interval of parameters do I think they are better in rehab? This is hard to give you a straightforward answer because it will depend a lot. Usually, it will depend mostly on a few factors. One of them is depth. If you have a joint like the hip, which is actually deeper and surrounded with more tissue than the elbow, you'll need to increase power, for example, and that's where you see higher values being used. And we should also use better wavelengths that will allow for tissue penetration. Then you'll have to account for the patient itself. Is it an obese patient? Is it a thin patient? Does it have a long coat? Is it a pigmented coat or skin? There you'll have to use higher power to reach your desired levels of fluence, which mean of irradiance, fluence, which means the amount of energy per area. If you're willing, you can either email RWD or myself, and I'll give you you can also find it in the papers, and I'll give you specific parameters for a specific condition because it's a little bit variable, but usually the equipment itself will help you choosing the parameters where you will be selecting the patient characteristics, the weight, if they're the body condition, and also the color, and that will help a lot. But this is a hard one to give you a very straightforward answer. I hope this helps. So another, I think this is more of a comment than a question. We need protocols for one treatment or several treatment, wavelengths, time modulation, etc. There are always some protocols, but not precise to what we need. It will depend on the device. So most devices will actually have protocols for the conditions. And usually we will not change the protocol depending on the number of treatments. We will use, I would say, when I say protocol in this case, I'm talking about the parameters. So if I have a wound, I will keep the parameters throughout the treatment course, even if I'm doing a single session or if I'm doing 10 sessions. I'm going to use the same one. Another thing that we have is now one thing that will influence this is the depth. That makes a lot of time. Wavelengths and time and using constants or a pulsed frequency, those have actually been answered quite nicely in most of the studies that we have available. We don't need a lot of wavelengths. Most equipments actually have one or two, depending on the type of tissue. We don't have a lot of variation. Time is actually dependent on the power of the equipment and the depth that you need to reach and the amount of energy that you need to reach that target tissue. So that will depend a little bit, but I'm not sure if this is more of a comment or a question. If you'd like to elaborate, I will happily address it again. And a good comment is how much tissue penetration do we realistically achieve in obese cats and dogs? This is a good one. It will depend a little bit. Again, it depends on what you're targeting. If you have an obese animal, even if you're targeting an elbow, it's going to be a relatively superficial joint, for example. If you're going for a hip, that's going to change a little bit. And it's the same, for example, if you're going for spinal conditions. For example, if you're going for degenerative myelopathy. And what we're seeing now is that some equipments are trying to do that by allowing you to have greater power. And there's quite a bit of studies done in cadaver for modeling where they will place sensors in dogs. This is usually done in dogs where they'll see that they have tissue penetration. The problem here, you'll have to manage a couple of parameters. One of them will be wavelength, That's quite important. Another one is power, the power of the device. And that will leave out quite a few devices available, but we have for sure tissue penetration. But the problem with these animals are going to be the amount of energy that you lose, the amount of time that you're going to need to employ in each treatment to be sure that you're delivering the amount of energy that you need, and overall depth is going to be the problem. If you're going for an abdominal condition, which is probably the major problem, yes, it's going to be a little bit more challenging, but it will depend on device. If you have only a handheld device that it doesn't produce any amount of considerable power and the amount of energy deliverance, you're never going to be able to reach those tissues, that's for sure. So another comment is, I've commented that laser can help with any kind of inflammation. And the question is, have I tried it as an adjuvant treatment in recurring otitis? So the short answer is yes, I've used it for every type of otitis. In some cases, particularly if it's not a recurrent or a very complicated one, I've used it as a single treatment in the past. If it's not good enough as a single treatment, you can use it particularly really early on to increase comfort and to decrease inflammation. And that will allow by itself for you to better clean the area and do the treatment without so much discomfort for the animal. So it's very, very helpful. One of the things that you should keep in mind is that in some types of otitis, you're actually going to see increased production of cerumen in the first day after the first treatment. But after that, you'll see, if you're doing it properly, you'll see quite a dramatic change in inflammation and pain control. And if not fully able to address the problem, it's going to help you do the other treatments like cleaning and local application of whatever thing that you use. This brings also another comment, is that if you're considering using laser to manage any sort of condition, for example, otitis, don't wait until you have like a very challenging case to use it. I know I said a lot of good things about laser, but this is not a silver bullet. If you tried everything and everything else hasn't worked, this is not going to be the thing that is going to save every condition. So I think this is something nice to use really early on, and don't wait until the last moment to use it, okay? So because if you do so, I would say that probably what's going to happen is you'll try to use it and you're going to be disappointed. But at that point, you had such a poor candidate that we are pretty much setting ourselves to failure. So Jeroen, you're thanking me, so I think you understand, you are happy with the question. Let's see, we had another comments in the chat. Let me see. So one of the questions that we have is that, can we use laser therapy in bladder cancer? So I wouldn't like to give you a very broad answer, because most of them will have some nuance. It will depend on laser type, and I'm not an oncologist, but as I told you, I know of a oncologist that uses laser to manage inflammation and pain in these situations. I wouldn't say that laser is going to be used to treat the cancer itself. It can be used, I think, to manage mostly the clinical signs and to help all of the problems that you're getting, not to treat the cancer itself. probably. I know there are a few protocols, for example, where they're using photo-activated nanoparticles, which means that you inject them and then you laser the tumor when you have like a skin tumor. And when you laser, the molecules will become active over that area. So they only have its effect on the tumor itself, not on the underlying tissues. That's one of the approaches that is being used. I'm not actually sure if you have specific studies for any type of bladder cancer. So I wouldn't say it's going to be used to treat the cancer itself, but more to manage the side effects and the problems that you have associated with it. So another questions that we have is that at first, should we use a human laser and maybe change the settings according to the patients, or maybe a veterinary use laser, but one from class 3 when introducing the use of laser therapy in the practice, because we are not really sure if the investment would be wise. And a comment, associated comment is, despite excessive medical proof, owners are still reluctant to pay for it. So this is a good question. So one first comment, when we have different classes of laser, they don't actually tell you a lot other than the power of the laser. For example, a laser that is class 4, that's the most powerful ones, the ones that we use a lot, and the ones that we use the most in veterinary practice. A class 4 only means that it is able to produce more than half a watt per second. It can go from half a watt to 25 watts. It's quite variable. It doesn't tell you a lot. It can be tempting to use a human laser. I can't say I've ever done it. I had veterinary lasers throughout my career, and I usually prefer using it. The reason is, if you're not really sure where to start, the equipment usually helps you in selecting a protocol and a few parameters that you can in the future tweak, but you'll have something to start with. And the problem with human lasers is that they are not really prepared to take into consideration some of the variables that we find in veterinary medicine. So, for example, the major one would be patient size. You have a lot of variability in patient size in veterinary medicine. Just in dogs alone, you'll have dogs with 1 kilogram, you'll have dogs with 80 kilograms. That's a big difference in terms of size and things you need to account. And another thing is coats and color. Obviously, we have differences in skin color in humans, but not so much. But in veterinary medicine, on top of that, you'll have differences in coat size. So I would probably go to a veterinary laser. I would use a class 4 laser because it's going to give you more possibilities. And usually, how I put this, when I'm trying to, I now only do referral practice, but when I was in first opinion, usually what we do is we put laser as a part of the protocol. For example, if the animal comes to surgery, I don't ask for the client if they want laser or not. Usually what we do is we put it in the protocol. And then we have everything outlined, what you did for that animal. For example, if you're doing an estimate for what something's going to cost, we will present everything from the pain management, the blood work, but it all comes in. And with the laser, we will put it already in it, and it will dilute a little bit over time. I understand it's hard to sell something, but for example, let's consider specific conditions. If you have a dog with diarrhea, for example, it's acute diarrhea, the dog just ate something it's not supposed to. At least in Portugal, what most practice will do, they will give a probiotic, they will possibly try to sell some foods that may help, something better for the stomach. And in some cases, usually not all or not that common, they will give some medication. But how fast does a probiotic work? Does it work by itself, or are you just waiting for the time to pass and the problem sorts out by itself? You've seen the difference with the laser, the pictures that I saw. It's quite fast. So that one works. So usually what I would do, I will switch one for the other. If you have something to work, something that works, usually I prefer it to something that might work. So that's one of another thing. And when you have, for example, another condition, let's go for cats. When you have cats with gingivitis, where you have chronic gingivitis and the client has to clean the animal's teeth with some sort of product that the cat hates, will try to bite the client most of the time, then the animal will come for immunosuppressive treatments that will not going to last a lot. And then you have laser that works. You're going to use it throughout the animal's life. That's true, but usually the animals like it and it works. It's not a better approach. Maybe it is. I think it is. But it's probably more of a thing of communication and thinking how you can position this in your practice because it works. And then it goes for word of mouth. If you're not really sure if you're able to sell it, or if you want to try it, ask for a show device. Ask for a device for you to test and use it alongside the protocol that you're using. But the time that the team sees the effect, and by the time the clients see how it works and that it works, usually they will ask for it as well. And nobody will opt out. But you can always leave that possibility on the table. People can opt out. But I will keep it as an opt-out, not an opt-in, if I make it clear. I hope it helps. Another questions that a couple of questions. Is there a possibility we could overdo laser therapy? That's a good question. I would be tempted to say no, usually not. The most that I've done would be twice a day, and I haven't seen deleterious effects on those cases. Overdoing it in terms not of treatment frequency, but in terms of improper use would be burning the animal because you're not using a proper technique. In those terms, yes. Other than that, because as I said, what laser is actually doing is bringing the tissue to its normal metabolic level, either the mitochondria or tissue healing. It's going to be regeneration at the normal level because with injury, that function is actually impaired. So there's a point where you cannot go higher. So by the time you reach the ceiling, the tissue is healing. You're not going to be able to induce, let's say, twofold, threefold, fourfold tissue healing. So it doesn't seem to be able to overdo, but as I said, I don't do more than twice a day. And those are very specific cases, like a post-surgical case where the animal has a lot of inflammation and pain, for example. So another question that we have is, what about benign tumors? Well, that one I don't know. I don't know if it's going to help or not. I would say that the same principles apply. Particularly if you're using photosensitive molecules, they are going to apply the same way. Other than that, I'm not aware of any other research about the treatment of benign tumors. So sorry, I can't really help on that one. So I think we've been through all of the questions in the Q&A and in the chats. Does anyone else have a comment or a question? So if not, thank you again for all of you for showing up and for your questions that were really nice and really interesting. I'd like to thank RWD again for making this possible. And if you have any other questions that you like to see answer, you can either send an email to RWD, they will forward it to me, or you can send it directly to me. I would be more than happy to answer any questions that you might have. Thank you so much for coming, and I hope to see you all soon. Thank you.